What is induration in a tuberculin skin test? Imagine a small bump forming on your skin after a test that checks for tuberculosis exposure. That bump is called induration, and it's a key part of the tuberculin skin test. When a healthcare professional performs this test, they inject a tiny amount of purified protein derivative, or PPD, just under the skin of your forearm. This creates a small, pale bump at the injection site. The test is designed to see if your immune system recognizes the tuberculin antigen, which would suggest prior exposure to the bacteria that cause tuberculosis. After the injection, the site is checked between 48 and 72 hours later. During this time, your immune system may react to the tuberculin if you have been exposed before. The reaction results in a firm, raised, hardened area called induration. It's important to note that redness, or erythema, around the bump does not have diagnostic value. Instead, healthcare providers measure the size of the induration by feeling the edges and using a ruler to measure its diameter in millimeters across the skin. The size of the induration helps determine whether the test is positive or negative. The threshold for a positive result depends on your individual risk factors. For example, if you are HIV positive or have had chest X-rays suggesting prior tuberculosis, an induration of 5 millimeters or more is considered positive. For people who recently immigrated from areas with high tuberculosis rates, injection drug users, or those with certain medical conditions, a 10 millimeter induration or larger indicates a positive result. In individuals with no known risk factors, an induration of 15 millimeters or more is usually considered positive. It's also important to remember that, if the test isn't read within 72 hours, the results might not be reliable, and a repeat test could be necessary. The measurement of induration is a crucial step in diagnosing latent tuberculosis infection or active disease. It helps healthcare providers decide whether further testing or treatment is needed. Always consult a healthcare professional for interpretation of your test results and personalized medical advice.